So guys, let's go for the aortic stenosis. And what is the meaning of the stenosis? And that is basically the narrowing, right? And this is your left ventricle and that is your aorta. Okay. And this is basically the root of aorta. And this is the root of aorta. और अगर ये रूट नैरो हो गई and that is called as the aortic stenosis, right? और stenosis तीन लेवल पे हो सकती है, या तो वाल्व के लेवल पे, या तो वाल्व के ऊपर, या तो वाल्व के नीचे. If it is above, then it may be associated with the Williams syndrome, and if it is below the valve, and that can be your HOCM, hypertrophic obstructive cardiomyopathy, right? And more commonly, it is at the level of valves, right? और disease शुरू करने से पहले we will just understand one concept, and that is basically the rate of flow. That is the area of cross section multiplied by velocity, and that is equal to constant value, right? And that is constant for the closed circulatory system, right? In this case, the normal velocity of aortic flow is 1 meter per second, and normal cross section is 4 centimeters square. And this value 4, that is constant for entire circulatory system, right? As in the case of severe aortic stenosis, the ratio is flipped. The area of cross section is just 1 centimeter square. So what is the velocity? The velocity is 4 meter per second, right? And that is basically the severe variety of aortic stenosis. So right, we will go for the disease proper. So now we will discuss about the etiopathogenesis, and that is more common in two age groups. Number one is the elder group, right? And second one is the young adults. In the case of young adults, that is basically the bicuspid aortic valves, right? And that is more commonly involving the boys more than girls. And if the girls are involved, then this is associated with the Turner syndrome. And two cardiac manifestations which are common in the case of Turner syndrome is, number one is the bicuspid aortic valves, and second one is the coarctation of aorta, right? So that is basically your young adults. And in the case of elder population, that is basically the wear and tear phenomenon. Now what occurs in the case of elder population is, there is first the mechanical trauma in the form of senile degeneration, which is followed by the inflammation, the active phase, followed by the chronic phase, and resulting into the fibrosis and sclerosis, and associated with the calcium deposition, right? And once there is deposition of calcium, and that is basically the stenosis. And the normal aortic valves are tricuspid, like this is one cusp, second cusp, and third cusp. And in the case of the ejection, these cusps open very much easily, and so that there is normal aortic flow. But in the case of bicuspid aortic valves, these cusps are present like this, and during systole, these valves open like this. So there is automatic stenosis in the case of bicuspid aortic valves, right? So that is basically the pathogenesis. So now we will discuss about the hemodynamics, right? So in the case of the stenosis, what occurs is, there is increase in afterload. Once there is increase in afterload, the left ventricle needs to contract very much with a high power so that the blood is ejected. That needs to be proliferated. So there is the left ventricular hypertrophy, and that is occurring here. So there is what? There is increase in thickness, right? And there is obliteration of lumen. So what occurs is, there is increase in the transvalvular pressure gradient, and so that the blood is ejected properly from the left ventricle to the aorta, right? So that is basically your hemodynamics. And now we will go for the clinical features. Number one thing is angina. So that is a game of the demand and supply, right? In the case of the ventricular hypertrophy, the demand increases, but in the case of the aortic stenosis, since the coronary arteries are arised from the root of aorta, and since the velocity is so higher at the root of aorta that the blood flowing through the coronary arteries are compromised because of increase in velocity at the root of aorta, right? So there is the compromised blood flow to the heart, and resulting into the decreased supply, and there is increase in the demand, right, of the myocardium, and that is resulting into the angina. And second thing is the syncope, and that is basically the imbalance between the demand and supply of the entire body, right? Since that is the fixed cardiac output state, right? So the supply is constant, a supply is fixed, but if the person works more, that requires more energy, and resulting into the syncopal attack, right? And that is second thing. As we know that there is increase in transvalvular pressure gradient, so ventricular pressure is always higher, right? And during diastole as well, there is increase in the pressure of left ventricle, right? And as we know that the blood flows from higher pressure to the lower pressure, so LA needs to increase its pressure so that blood is flown from the left atria to the left ventricle. So in this case, due to increase in the left ventricular and diastolic pressure, LVEDP, there needs to be increase in LA pressure, right? So LA pressure needs to be increased so that the blood is flown from the LA to the LV. And once the pressure of LA is increased, LAP is increased, there is increase in pressure of the pulmonary veins, and pulmonary vein pressure should be increased, and this increased pressure is transmitted to the pulmonary capillary bed, right? So PCWP is also increased. So PCWP is also increased, so that is resulting into the transportation of fluid from the pulmonary capillaries to the lung parenchyma, and that is resulting into the boggy lungs, and that is resulting into the dyspnea. So now we will go for the signs. Number one is the pulse. So in the case of severe stage of the aortic stenosis, the pulsus tardus is present. Okay, normally pulse is like that. This is pulsus tardus. Okay, so pulse is retarding. So up to the severe variety, the left ventricle is compensating itself, right? So that is resulting into the heart failure in the case of the severe variety, very severe variety. Okay, so that is resulting into the pulsus tardus et parvus. That means it is like that. Okay, so pulse is retarding, number one, and second thing is parvus. Parvus means its amplitude is lesser, and that means its volume, the stroke volume, is compromised. So that's the case, right? And next thing is the BP, right? And because of the stenosis, the systolic BP is compromised, and because of the perfusion to the kidneys are compromised, and that's why there is activation of a RAS mechanism, and that is resulting into the increase in the diastolic BP, right? So that there is decrease in the pulse pressure, and since it is left-sided condition, and that's why the JVP is normal in this case. And now we will discuss about the apex, right? And that is shifted. So that is your chest. So that is your chest, right? And that is your normal cardiac position, right? Now in this case of the aortic stenosis, the left ventricle is enlarged in the lateral position, okay, towards the left lateral side. But in the case of volume overload condition, as the aortic regurgitation or mitral regurgitation, this is enlarged in this direction, downwards and laterally, right? So that's the case. Now as in the case of the cardiac sounds, number one is S1, right? S1 is normal. Now in the case of the S2, and that is basically the narrow split or single split or the reverse split. So that is basically your A2, P2. Now A2 is 30 millisecond prior to the P2, right? So this difference is become narrower, and in the case of the very severe variety, that even becomes reversed. That means in the case of very severe variety, P2 is followed by A2. That is called as the paradoxical split or reverse split. So as in the case of the S3, which is present only at the case of the very severe variety because of the association with the cardiac failure, right? And that is because of the turbulence of blood in the left ventricle. Now we will go for the S4, and what is the definition? That is basically the healthy atria contracting vigorously via the normal atrioventricular valves into the non-compliant, non-dilated, as in this case ventricles are non-dilated, non-compliant, and which are hypertrophic, right? So that is basically the fulfilling the criteria, and S4 is present in this case. And now we will go for the murmur, and that is basically the ejection systolic murmur or crescendo decrescendo murmur, and that is basically the medium pitched murmur, and that's having the two components. Number one is the low pitched one, and second thing is the high pitched component, right? And the low pitched component is radiating towards the carotids, and the high pitched component is radiating towards the apex, right? And that is called as the Gallaudet phenomena. Now as we have discussed earlier, that A into V, A is area of cross section and V is the velocity of blood flow, and that is basically constant. So in this case of the cross section, and another table is your velocity. And 4 divided by this thing, and 4 divided by 1, and 4 divided by 0.5, and that is basically your velocity. Now as we have discussed earlier, the normal aortic cross section is 4 centimeters square, right? And the velocity, peak velocity, is 1 meter per second, and the gradient between the left ventricle, that is left ventricle, and the aorta, okay, this pressure difference is basically 0 to 10, and that is normal case. But in this case of the severe variety, the ratio is flipped, right? So the aortic cross section is 1, right? Velocity is 4, and the pressure is corresponding. The pressure is proportional to velocity. More is the velocity, more is the pressure, right? Now we'll go for the ECG findings, right? And in this case of ECG, but in this case, what is the feature for the left ventricular hypertrophy? Number one is the left cardiac axis deviation. The cardiac axis deviate ho jati hai towards the left side. Number two is a criteria, and that is basically, now this is your P2RS ST segment and T wave, right? So, and that is Q, R, S, T, and that is P wave, and that is basically normal ECG, right? But in this case of what? In this case of the left ventricular hypertrophy, what occurs is, so QRS complex is like that in the V1, and in the case of V2, and in the case of V5, the QRS complex was like that. So that the addition of the S wave of V1 and R wave of V5 must be more than 35 mm, okay, or 35 small squares. That is the criteria for the left ventricular hypertrophy. And now we will go for the management of this condition, that is the aortic valve replacement. But what is the criteria for this replacement? Number one thing is the patient must be symptomatic. These three features of symptoms must be present, number one. Number two is, if it is asymptomatic condition, that must be associated with the velocity of more than 5 meters per second. Meanwhile, the area of cross section must be less than 0.8 centimeter square, since the multiplication must be 4. Got it? Now, and if it is rapidly progressing in 1 year, that is a feature for this, right? And if the patient is not fit for surgery, we can go for a TAVI, and that is basically transcatheter aortic valve replacement. So guys, this is it with respect to the aortic stenosis, and I will upload these slides to my Instagram account, that is the Integrated Medicos, and thank you for watching.